So good morning, everyone, and thank you to the COLDA committee for the opportunity to be here today. So this study evaluates alternative triage strategies to identify pregnant women who are at a high risk of mother-to-child transmission in order for them to receive targeted antiviral prophylaxis. And this study was conducted within the Gambia and analyzes data from the TriMum study. So hepatitis B virus is the leading cause of cirrhosis and hepatocellular carcinoma in the Gambia. And unfortunately, prognosis is poor, with a study showing a median survival of just 1.5 months, really highlighting this as a critical public health issue. So between 2020 and 2022, 4.5% of pregnant women in the Gambia were HBV positive, and this figure is likely to be even higher now. So HBV spreads mainly through mother-to-child transmission. So women with a viral load of over 200,000 have a high risk of transmitting the virus, and therefore targeting this mode of transmission is crucial to meet the WHO's goal of eliminating viral hepatitis. So preventing mother-to-child transmission requires 2 key steps. So firstly, identifying women with high viral loads and ensuring that they're receiving daily antiviral prophylaxis until at least 2 months postpartum. And secondly, giving newborns the infant hepatitis B birth dose vaccine within 24 hours, with the timing of this being crucial for effective protection. However, in low-resource settings, such as the Gambia, these steps to prevent transmission can be difficult to implement. So viral load testing is expensive and often unavailable, and there is a low coverage of the infant birth dose vaccine. So where viral load testing isn't feasible, we need alternative strategies to identify high-risk women, and the TriMum study assesses these simplified strategies for HIV, syphilis, and HBV in Burkina Faso and the Gambia. So these alternatives include a test and treat all approach, where all HB surface antigen positive women receive treatment regardless of viral load, or using the hepatitis B correlated antigen test, a new rapidly emerging point of care test. So this study compared test and treat all versus viral load-based strategies based on maternal retention, adherence to prophylaxis, and a timely coverage of the Hep B birth dose vaccine, and also aimed to assess the accuracy of correlated antigen testing. So this was a preliminary analysis of data from the TriMum study on pregnant women with HBV monoinfection enrolled across 4 health facilities in the Gambia, 1 using a test and treat all strategy, and the other 3 using a viral load-based strategy. So data was extracted from the electronic database REDCap, such as lab results, appointment dates, adherence questionnaires, and infant vaccination dates, and the antenatal registers were also reviewed to fill in missing appointment dates. So 150 women were in the final analysis for this pilot study, 39 in the test and treat all group, with all 39 being eligible for antiviral prophylaxis, and 111 in the viral load-based strategy, with 6 having a viral load of over 200,000 and thus being eligible for prophylaxis. So although these sample sizes are small and definitely need to be validated in larger sample sizes, trends show that retention and care was lower in the test and treat all strategy, with 11% fewer women fully retained and 4% more lost to follow-up. Non-adherence to antiviral therapy was slightly higher in the test and treat all strategy, by around 14%. And a timely infant birth dose vaccine coverage was similar between both strategies at around 77%, showing that the strategy used did not seem to affect vaccination rates. And hepatitis B correlated antigen testing was promising, showed a specificity of 97% and a sensitivity of 90%. And you can see on the y-axis the viral load values, and on the x-axis a positive or negative core antigen result for both capillary blood and plasma samples. And the red dashed line just shows the threshold for a high viral load. So to summarize, the test and treat all strategy avoids expensive viral load testing and enables faster treatment initiation. However, it may reduce retention in care and adherence to treatment. It's shown to not be cost effective, and it exposes women with low viral loads to unnecessary medication. So this is where hepatitis B correlated antigen testing is a new, promising, affordable alternative to sort of risk stratify women in need of prophylaxis. And just a huge thank you to the patients and their families, to the MRC team in the Gambia, and to all of our donors. Thank you for listening.